Good afternoon. It is December 11th, Friday noon. This is United Medical ACO. We are here for today's update, the weekly update from the recent developments. I have Richa Sabesan with me. Richa is director, she's one of our directors, and she's in charge of the billing and operation and revenue cycle management. Richa, if you would please introduce yourself as well.
Sure. Thank you, Kemal. Like Kemal said, my name is Richa Sabesan. I am the billing director for United Medical, and I handle revenue cycle operations for the company.
So, well, Richa, first, thank you for joining me today. So, Tanner was off, and then we have a couple of guests for the next weeks, but today we didn't have anyone. And then I asked Richa last minute, and then she was available. Thank you for that again. Actually, this was kind of timely because we have done so many of these events by now. And although we are going through the clinical updates, there are certain things that we do for our clients in the core of our business, which is one of our main services on the medical billing revenue cycle management side. And I thought Richa would be able to give us the updates. So before we go into those, we are going to also discuss the vaccine update for COVID-19. So let me actually start sharing my screen, and I believe everyone can see this without a problem. So I need to mention this one more time, maybe for this week, maybe after this week, I'll take this off, but it's the quadruple aim where we have the improved health outcomes, lower cost, and better patient experience. We add the physician and physician practices into this. So because this is important, United Medical is the advocate for private ambulatory practices, private medical practices in a better term. Our providers, our physicians are independently owning their practices, and then we are under the United Medical ACO platform, and everyone is in the clinical and financial integration in a different way than maybe just owned by one practice or one healthcare model. So everyone has a different level of interest, and then we are keeping them all together for our client needs. So today, again, the COVID-19 numbers that I'm going to go through, COVID vaccine update, and also we have our internal survey. I did introduce that last week. We have more response to that, and then I'll share that, and then some recent updates with it. And then, as I mentioned, Richa is going to help us with the revenue cycle management. So when we are looking at the total number of cases, right now we are reaching to 10 million total confirmed cases. Now, I'm sorry, 16 million total confirmed cases. Almost 300,000 people died, and then about 9.3 million people recovered. Now, I always share this daily updates. This is important, and I know many of you have heard this. And then you may be like, well, come on, we know this already, but we are actually going through a different level of this problem. As you can see, 2 days ago, we were at 226, almost 227,000 cases. And yesterday, it was at 218,000 cases. Number of people who died yesterday, it's almost 3,000. And then 2 days ago, it was a little over 3,000, it was almost 3,300 people. So those numbers are increasing, and we were expecting some of these for the flu season, winter, and all those different things that we were expecting this number to go up. However, it is happening a little bit faster than I think we were even projecting. Now, I always share the Delaware numbers from here, and I will bring the Delaware updates. We hit our highest hospital admissions for COVID-related ones, and that was about, I think, 350, if I'm not mistaken. So yeah, 349 as of yesterday. Actually, that's as of Wednesday. We don't have yesterday's numbers. Hopefully, it's not too bad, but that number, as you can see, increasing. And then for the total number of cases, new positives, we have on December 8th, we have the highest number at 811, the 10-day average. And then right now, that number is about like 790 as of yesterday. So these are where we are with the numbers. Now, from here, there is a new update from the Governor Carney's office with the household stay-at-home advisor from December 14th to January 11th. So many of you already got that update from the state website, but if you have not, you can actually either get it from state website or from our social media channels. Now, Richa, we have our provider meetings on a regular basis. Now we do them on Mondays and we have them on Thursdays, right? So one of the things that you and I, while we are presenting, one of the new stuff that we did is the surveys for the vaccine, whether or not people are trusting the survey, what type of issues we have. But in our meetings, we also go through the number of total positives in the United Medical ACO, and then how we are actually managing those orders. So we have the last 3 weeks averages is about 17.5%. And it was like 17.5, 16.8, and then 18.1. And these numbers are representing our total number of orders, and then we keep track of these on a daily basis, and this helps for our patients to complete those in a timely manner. Now, the other thing that I introduced this last week, there are so many people who are not following up on their orders. After we reach out to them several times, there are still people who are not completing them. So when you look at these 4 weeks, the yellow represents the patients who didn't complete the process, and the red is the positives. So like the week of November 9th, we have like 28 people who have given the order of the test, but then they have not completed. And then there are 12 on the November 16th, and then there's 6, and then this number will probably go up because we are not done with all the order updates. Now, Richa, what do you think that people don't complete their orders when they are given the test?
Well, I think
they're scared.
Yeah, I think it's that normal compliance type of issue as well, which doctors talk about. They advise the patients to go and get something done. I think perhaps maybe fear, like you were saying, or also maybe just lack of time. Mm-hmm. Perhaps they're not able to go out and get the test due to being at home or having their children at home with them. I think there's a number of factors, but I think fear is definitely one of them.
So the other thing that, Richa, have you done any telemedicine visit as a patient?
I have, yes. I've actually done a number of telemedicine visits, Kemal, and I actually have one this afternoon. I think the experience is really positive, and I really think that it's a great way to get medical care without putting yourself and others at danger when you don't need to be at the office.
So, and you have parents who are over 60. I'm not going to give their ages, but I think your mom is maybe 27, but technically maybe she's over 60. So how are they handling those visits? Are they also comfortable with the telemedicine?
Yes, so my dad has done one telemedicine visit actually with United Medical Clinic. And my mom has also done a follow-up visit via telemedicine. So they had good experiences.
That's really nice. So this is the total number of appointments as United Medical ACO we handled this year. It's about 410,000 appointments. It represents almost 110,000 unique individual patients. Given the fact that the Delaware population is about 930,000, I believe, right, guys? We are providing the service for a big chunk of the population, and we are happy to do that, and we are happy also to do this safely. Now, the one interesting thing, Richa, you see the hospitals numbers are going up. So when we look at our numbers from United Medical ACO, we also look at those numbers on a weekly basis. Actually, the week that we had the highest in Delaware, we had the lowest in United Medical ACO. Now, I would like to think that that's because of the close follow-up that we have with the patients, and then also making the telemedicine available for every specialty where it's appropriate, and providing those technical need for the practices and educating the patients. And I'm really happy to see our numbers being much lower than what the state is going through, although we live in the same state and we want to help, but we are in charge of our population, so that it's kind of like nice to see that. Now, the other thing is, for those who may not know, Richa's husband is a surgeon, so we also have a surgery center. We have our new billboard is up there on 95. So one of the things why I brought this up, not because we have this nice billboard now, but it's because we do our bariatric surgeries. Although we did eliminate some of those elective procedures or screening type of colonoscopies, we are doing those restrictions so that we can do we can actually provide the service for our chronically ill patients with obesity. And right now it's almost like 3 to 4 procedures a day that we do, and it's the safest way that you can actually get the procedure. And there's the screening that we are going through. There shouldn't be any issues. We have not had any problems with any of our patients, and I'm actually pleased to provide that update for you guys. So the safer at home, we say this, but how are we going to do it? And the vaccine is coming now. Before we dive into the vaccine survey and the vaccine update, I still have my own issues with the vaccine, but because I had my COVID positive in the earlier time in April, so I guess I don't need to rush. But for the general population, what would be the right thing to do? And it's our job to make sure that we can provide all the updates, and then everyone can make the decisions at their best. However, today, if someone is asking me, I'm in a little bit better position to say the vaccine would be the right way to go with all the findings that we have. So if there are people who are in the front line and they need this more than anyone else, then they should be going through this without any delay. There are different types of vaccines, obviously. There are different questions. So what we did, Richa was part of this team. We actually asked our providers, and then we asked public how they would actually decide on the vaccine. And here's our outcome. So there are about 142 responses we received, and about 60% is saying that yes, they are comfortable with the vaccine. Now there are 40% who are not comfortable. So just so that this is transparent, so I have to answer twice. I answered one no and one yes. Like I did the no first, and then I didn't want to delete that, and I added a yes one. So then I'm on both sides. So even if you take that out, this is showing us that there is a big issue in terms of people, how comfortable they are with the vaccine. Now, Richard, you don't have to say it if you don't feel comfortable, but what's your plan?
Kemal, I am happy to take the vaccine as soon as it's available to the general public. As you mentioned, my husband is a surgeon at Mainline Health. They will likely be getting the vaccine in the next couple of weeks, and he will be taking it. So I think for my protection and protecting those around me, I feel comfortable taking the vaccine, Kamal.
And these are some of the answers from the people who said no, they don't want to take the vaccine, and this is their reasoning. Like some people say are not comfortable with the lack of time to research. Some says Pfizer has some infertility in women and the kids. Some has they really don't know what it is. There was a long answer here. Prior to this, Richa, you remember how there are some people who really don't want to get the vaccine at all, and they don't want to do that for their kids as well as for themselves. So we were expecting, but I'm seeing 40%, and I think 40% is kind of big. And what we would like to do is just kind of focus on the education and outcome of the vaccine, what the findings are, so that we can actually provide those updates. Now, like this person says, I have small children and would not like to get vaccine that they would not receive. So she wants them to receive at the same time. I don't know if that's a clinical concern, but prefer wait a little bit more. So I do see a lot of these where people want to wait a little bit more. Now, so the way the people that I talked to, providers, physicians that I talked to 3 months ago, they were also a little bit hesitating with the vaccine. But today, I did my own internal study with my physicians, and everyone is going to receive the vaccine. So there's no exception from the physician side. So because they're comfortable, I think I'm also comfortable from my side. So now the education is the key. Now one is with the Pfizer and biotech. There were some, there are 2 cases actually with the allergic reaction, and they were suffering from different allergies prior. But those people are still now recovering. They are doing okay. They didn't die. So it's not like it's a worse outcome, but
those are patients that had very chronic allergic issues prior to taking the vaccine. They were EpiPen carriers. So they were not just people who were having seasonal allergies, they were people who had very severe allergies. So I don't know if there's any evidence that ties it back to the vaccine, but I think what they're doing for caution is telling those folks that have very severe allergies to perhaps not take the vaccine.
Sure. And again, the best, in some cases, the benefit of getting it versus not getting it is a lot higher, so that we may have some bad outcomes. But if you don't get it, the bad outcome is going to be at a greater scale. So I think that still is the concern. Now, the other thing is the alcohol for 2 months after COVID-19. So that's something that was reported from Russia. I think they can handle that, right? 2 months?
In Russia, maybe not.
So yesterday, FDA advisory panel gives a green light for the Pfizer vaccine. And I think in the next couple of days, it will be available for emergency use. That's my understanding. Richard, you were at the meeting last night, I believe, with the providers meeting. I missed that. I don't know if there was any new update from Anthony, but I believe that was, they say that it's going to take anywhere from 1 to 7 days after this one.
Correct. Yeah, he gave a very similar update, Kamal, just letting them know about the Pfizer green light.
Now, in this advisory panel, Richard, there are 4 people actually, they were opposed to the vaccine. So that means at that level, there's still that hesitation. So it's understandable if the people are not comfortable, but let's make sure that we get the most educated education out there that's available to us. Now, I read this, I believe, a couple of days ago with the India speeding up review of Pfizer AstraZeneca vaccine. Rich, I know you were reading this article. Anything interesting here?
I think the biggest thing for India, Kamal, is there's a very large lack of infrastructure to be able to actually administer this type of vaccine based on the temperatures. I believe that they need to be stored at almost sub-zero temperatures. Being from India, I know firsthand there is very difficult things to overcome to be able to distribute a vaccine like this. Just lack of storage, I think. So I think that was my biggest takeaway from here. I mean, I think them speeding up the review and maybe okaying it is fine, but how are they going to distribute it? How is that going to work?
There will be different challenges with that. So
absolutely,
especially with the population and just the infrastructure. You're right. So let's see how that's going to process. Now, I actually took some of the screenshots so that I can actually easily share these. Some issues with people with really severe illnesses such as cancer and other types of issues. The vaccine may not be the way to protect them. That's what I'm understanding. There are some people, like this is also kind of like the understanding of why people have the vaccine fears that, even in today's day and age where people don't want to do the HPV vaccine, even though this is actually preventing those cancer type of situations, people still don't want to get them, right? So this HPV, is that the one where we actually, like Gardasil is one of them, I guess, right?
Yeah, actually, I was in the first round of this. I took it in my 20s. Yeah. So it had just come out, and my doctor recommended it, and I actually got vaccinated for this, Kemal.
So I guess again, understanding these issues now, like this is from the Bloomberg side, those refusing vaccine could be the reservoir for the virus. So this is not just one individual or one group of people, but this is the public safety, public health issue. And I don't know if we are able to just do it on one side and not do it on the other side. So this is something that is going to require us to have, I believe it's almost 70% of the population have to get it before we have the immunity at some level. So now, some of these, which I got them last night, so I need to make sure that I remember what they were. So one of the challenges that people have, Richa, I don't know if you are following this, but I'm sure you do because at home you probably talk about these things also. The way that this vaccine with Pfizer and AstraZeneca and the traditional vaccine is normally what they do is they actually give the dead cell of the vaccine, the virus itself, and then your body actually is attacking that, and then you have the immunity. But this time, the messenger RNA, which actually tells your body to react certain way, is a not new method, but it's new for this type of vaccine. So then people are kind of like going crazy and then thinking that they are going to be kind of like chipped, or like their DNA is being changed, or like, well, these are already done in different vaccines. It's being used, but it is new for this type of vaccine. But it shouldn't be the reason for people to feel, well, it's not like what I'm trying to say is that it's not something new. So we have done the messenger RNA in different vaccines. So it shouldn't be the reason for people not getting it. And then the other thing is, again, if people are, the risk that people are getting less than 2%, like the group that may be with the side effects is less than 2%. So when you look at the total benefit of the vaccine, then I think it makes no sense to not to get it. So again, in our meetings, we'll be updating public with what needs to be done. And the vaccine is, in Delaware at least, is going to be distributed. I believe it's starting this month. If I'm not mistaken, there's about 14,000 available. And then we will be updating everyone based on what we have. Now, Richa, I do want to talk to you about the revenue cycle management. And well, this is your core business. You are in charge of the RCM for United Medical. So one of the latest articles that I wrote was about our system. Now, if you can just give us a brief summary of what it is that we do with the RCM and why we would be different than anyone else.
Sure. So our revenue cycle management system is very robust. We have a number of different layers and steps in place to ensure that we have clean and proper processing of claims. In relation to COVID, of course, we had to deal with a number of challenges based on new CPT codes, new diagnosis codes, a different way of billing, essentially, and especially with the introduction of widespread telemedicine. We had to really make sure that every insurance was getting the claims the way that they were appropriately going to be processed through their system. So I think that was the biggest role, Kemal, that the RCM probably played when it came to the pandemic is just assuring that every patient that was being seen was actually having a claim processed in a clean and seamless process.
So, Richard, how many total states we are in now?
I believe we're in around 40, Kemal. I haven't checked recently, but I would say it's anywhere from 36 to 40, I believe.
Okay, and then it's about like 125 total different practices, I believe, right?
Yeah.
And like a little over 20 specialties.
25 specialties, I think.
So now we do client satisfaction surveys as well. So just some background on that and then how our numbers are.
Sure. So we send out monthly and quarterly satisfaction surveys from the billing department. Our client managers actually send them out to the providers for feedback on how we're doing as an organization, if they're satisfied with their billing services. Over the previous 6 months, we've scored 98% or above in terms of satisfaction, Kemal.
So, and then we do this on a monthly basis, you said, right?
Yes, most of the time we do it monthly basis based on what's happening with the client. So if we have a client that is experiencing some, roadblocks and concerns, we want to check with them every month to make sure that they're still satisfied and everything they're getting is being done. For a I don't want to call it problematic, but for a very straightforward practice, we would normally send the survey once a quarter. That's our process.
I can actually bring up our Q2 score from our clients. So, so there were about 64 responses that we received in Q2, and only 3 clients, 3 responses that we had negative, and then 95.3%, which is an extremely high number for this type of service business. And I'm extremely pleased with the services that we are providing, and thank you for leading that team and that service. So it's really important for us. Now, Richard, we do have an operation outside of the United States. So I guess with the changes that we have with the pandemic, now in the remote services or remote offices, so this is becoming a less and less an issue. So any feedback from that?
Our overseas operation is really integral, Kemal, to our department and how we run. They, assist us in every single aspect of the revenue cycle process. They do everything that our associates here at our business office in Bear do. So having them as a resource has been wonderful. And also because of the time difference, they work a little bit earlier than we do. So they are able to catch patients in the morning, very early in the morning, and take care of certain things for us, even prior to us logging on here in the United States. So I
heard that their office is nicer than ours here.
I think it is. They have a Starbucks below, I think.
So no, they're in a really nice complex. So we are a little bit jealous, but it's okay. So All right. Well, Richard, the other thing that we have, as you know, we start having these sessions. Part of the issue was what can we do for the public that we can actually add more to the telemedicine, telehealth, like how we can be more resourceful for our patients and society. So now with this, we actually started we ramped up our YouTube channels, social media between United Medical, my personal one, CRIAS, our bariatric practice, and colorectal practice, and our surgery center. We are reaching out to 120 to 150,000 people every week. That number was not nowhere close to that. Now, one of the, again, reason that we are doing this not only we are doing it for resourcefulness standpoint, but they can also easily find these different events. Now, there are different groups of events. The Friday one is one, and outside of that, we have our bariatric seminars, webinars, live sessions, then our diabetes program with the Wednesday Wellness. So those are all add-on resource that we are trying to make it part of the United Medical ACO digital health, so that as the culture is kind of forced to change in this direction, we are taking the approach in a way that we want to champion this, so then we are able to actually provide the best service. Now, from this, what's really important for us and for our patients, telemedicine is only going to be very useful if you are utilizing your patient portal. So if you are not using your patient portal, telemedicine is going to be slightly hectic. So I really do emphasize the patient portal. It's your chart. As a patient, you should be in charge of your chart. It helps with the communication of to the office. You can actually do so many different things through your IQ Health. The many phone calls we receive, and we are not able to take those calls in a timely manner where patient gets really frustrated, is the things that you can actually do it from your phone. Your upcoming appointments, your scheduling new appointments, you're canceling your appointments, looking for your lab results. These are all available through the chart, through the portal. So you have two different options. You call us, we have limited number of people who can answer the phone, but we provide services for a large number of patients, and you can be on the phone for 15 minutes while you can get something on your phone directly with less than 10 seconds. So we really want our patients to take this seriously and then make sure that you activate your portal. It is your chart that you are actually accessing, and you should know your chart better than anyone else. Now, these are different events. Again, the way that we are indexing these events. So for the ease of access is a different playlist that we have, and hopefully we are getting enough support out there. And that's, I believe, what I had on this side the last. So next week we have our bariatric events on Wednesday, and then Friday we have the session. We'll probably have more updates from the vaccine, and then hopefully all good updates. And I'm really watching that very closely to make sure that we can provide you the most accurate update, and we'll kind of dive into the patient portal utilization a little bit next week. And then in the meantime, if there are any questions, you can always reach out to us through our regular channels or from the social media channels. Richa, anything that you would like to add before we close?
No, Kemal, thank you for having me today. I appreciate the opportunity.
Well, thank you for joining me. Do you want to say something before I let you go?
Sure.
So this one was my ugly sweater. So then now Ann Wilson, my wonderful assistant, wants me to wear this. So I'm kind of like refusing, but at least I'm going to show it to everyone so then they know that I have this. So let's see if they can actually twist my arm enough before I change. So, all right. Well, thanks so much again, and then we'll